Getting HIV-Aids is not a problem or a crime. Being born with HIV-Aids did not stop this girl from growing and progressing well over the years. Today, she prepares to go to the university. According to her, the government played a huge role over the years to ensure that there is little or no stigmatization. I want to be a doctor and I will work hard. I am working towards having an HIV-free family. There is no stigma. Rwanda Network of People Living with HIV, RRP Plus spokesperson Moneza Sylvia echoes that stigma has reduced greatly over the years. I knew of my status in 1998. There was high stigmatization back then from neighbors and family. The government did everything to sensitize people on this, even at the village level. Dr. Innocent Turate, the head of HIV and other infectious diseases control department at Rwanda Biomedical Center, explains that good services helped in reducing the stigma. We sensitize people a lot and also ensured that they have good medicine so that everyone got medicine, and this gave people hope, which in return reduced the rate of stigmatization in the country. A study released by the Rwanda Biomedical Center RBC on Tuesday found that HIV infection in Rwanda is at 3%. Of these, 3.6% are women and 2.2% are men. In rural areas, the rate of HIV is at 2.5% and in the city at 4.8%. From October 2019 to June 2020, the rate of stigma for people living with HIV has decreased by 80%. Rwanda is one of the few countries that have achieved the goal of the United Nations Office on HIV-Aids by 2020, where at least 83.8% of the population between the ages of 15 and 64 are aware of their status.
With that, of course, I'm now joined by Saj Sebafara, who is the Executive Secretary of the Rwanda Network of People Living with HIV in the country, to help us talk more on this. Thank you very much, Saj, for making time to be with us. Saj, if you can hear me, good evening to you.
Yes, good evening.
Thank you very much for joining us. Now, how has stigma been an issue over the years and how has it changed?
Yeah, thank you very much. After 10 years, the first stigma and discrimination survey was conducted in Rwanda, and which has shown a high level of stigma related to HIV in Rwanda. Different interventions and activities have been carried out regarding the response to HIV, and particularly against HIV-related stigma and discrimination issues. If maybe I can do a comparison of 2020 stigma index 2009, it shows that the decrease of 80% of stigma and discrimination experienced, especially in physical harassment and discriminatory gossip and excision from religious activities. Now we can see decrease of stigma in religious activities, social gatherings. We can see a considerable decrease of stigma and also stigma within the family's activities, and also a decrease of more than 50% regarding people living with HIV rights abuse, forcing, for example, people to be tested either for insurance, health care, and visa, and so on. So Rwanda has made a huge achievement in regards to stigma and discrimination reduction.
What are the other challenges that the people living with HIV are facing today in the day-to-day lives?
Yeah, despite the decrease of stigma and discrimination in the country, however, there is still a stigma and there is still work to do. For example, the stigma and discrimination is very low in Rwanda, is 13% as per the dissemination of the study today. However, human rights and effective change component and needs improvement. And also knowledge of people living with HIV of their rights, and also to know about laws and policies that protect them was still low. And the fear also of people living with HIV to disclose their HIV status to others was still prevalent. And also we can see at the key and vulnerable population, there is still a risk of facing double stigma. For example, those who are doing sex, men who are do sex with men, they are still facing stigma and discrimination. And also women and students, they are still facing stigma and discrimination. Young women also are still facing stigma and discrimination in the community. So there is still a journey, and we believe that working together, this can be reduced, and Rwanda can be ranked in a very good country fighting stigma and discrimination.
Center that supports the patient that someone can call in through the toll-free line. How does this work?
Yeah, during the COVID-19 lockdown period, since March, where we knew about the first case of COVID-19 in Rwanda, the Rwanda network of people living with HIV has initiated a toll-free, which is 2014-45. This toll-free is free of charge for the community callers, whereby people living with HIV and the general population can call and give their feedback on the quality of HIV services received at the health facility. So as you may know, during the lockdown period, there was limited movement, and people living with HIV and other patients could not easier get their health facilities. So this toll-free was being very helpful to the community, because we started to do home-based medicine delivery. So people could call and request the home delivery services. And the toll-free helped us also to do the community monitoring on HIV services.
Lastly, before I let you
still now, this toll-free is still operating, and it's still helping people.
Absolutely. Lastly, before I let you go, how's the treatment then improved over the years? Because I know over the years there's always been a problem, people wanting to have only one pill, others preferring probably injections if there's any. How's the treatment improved?
Yeah, as you may know, during the past years, the service was not decentralized. For example, in 2009, most of the patients were followed at the district hospitals, but now, today, in 2020, all HIV services are delivered at a decentralized level. Each sector in the country has a health center where also people living with HIV can access their treatment easily. And also it was been very successful during the lockdown, because RBC revised the guideline on HIV management, where people living with HIV could access the treatment at the nearest health facility. So we are happy that the service delivery is at nearest health facilities, and also the program has very much improved in terms of the quality of service delivery. So we believe that if we are going for 2030 to end AIDS, Rwanda is at a good rank to be close to the 2030, and even why not getting zero stigma and discrimination and 100% people in treatment by even before 2030.
Absolutely. Thank you very much, Serge Semafara, of course, for making time to be with us and helping us understand more on what's happening on ground.
Thank you very much.